One of the most common running-related injuries that we'll see in clinic is an Achilles tendinopathy. An Achilles tendinopathy is an irritation of your Achilles tendon, and it may or may not have inflammation. The old terminology of tendinitis insinuated that it was always inflammatory response related, and it means there was inflammation within the tissue. But now we know with research that that is not the case. So what is your Achilles tendon? What does it do? Why does it get irritated? How can you assess if you have an Achilles tendinopathy? And then more importantly, what can you do to get it better? Let's get into it. So what is your Achilles tendon? Your Achilles tendon is a thick piece of fibrous tissue that connects the muscle to the bone, and it helps to take force from the muscle into the bone and facilitate movement. When you spike your training loads, so for bringing in too much volume or too much pace, that starts to cause the Achilles tendon to adapt. But if you bring that in too fast, too soon, without subsequent rest and adequate rest, then you're not going to have the positive adaptation, and that tendon starts to break down. Unlike muscle, which adapts really quickly, so with your muscle, you get this really nice 1 to 2 week adaptation where you feel like your muscles are strong enough, it can get through and progress. Your tendons don't progress the same way. Your tendons almost need 4 to 6 weeks after that to get the adaptation rate. So if you're not getting nice periodic deloads within your training block, what you'll find is over time, that tendon can't keep up with the changes in your training and starts to break down and starts to get irritated. So understanding your training load is super crucial to understanding if you've developed Achilles tendinopathy. What we'll see in clinics, we'll see spikes in training load, either with volume or pace, and we know that's going to be a hallmark sign as to why things have gotten irritated for that runner with respect to the Achilles tendon. Another factor to consider is your shoe selection. So we know that shoe ramp or shoe drop can impact Achilles forces. So what is shoe drop? Shoe drop refers to the height on your rear foot of the shoe versus the height of the forefoot. If you go online onto Google, type in the name and the brand and the model of your shoe, it will tell you what the drop of that shoe is. The higher the drop, the easier it is for your Achilles. The lower the drop, the harder it is for your Achilles. So if you've transitioned from a high drop shoe to a low drop shoe, that's going to increase forces going through your Achilles. And then if you go out for a long run or a really fast run in those low drop shoes, now you've doubled down on the forces through that Achilles, and can be a nice little ingredient and recipe for your Achilles to get irritated. Another causative factor for your Achilles tendon to get irritated is a lack of strength in your calf. If your calf is not strong enough, that's going to put a lot more pressure onto the tendon progressively over time. That's going to irritate the Achilles. And finally, your running technique. If you have a low cadence, what that forces you'll put to do is it forces you to spend more time with the ground. It forces your knee to bend more when you're in the mid stance of running. Subsequently, that forces the ankle to flex a bit more and stretches out the Achilles to work harder as you have to then generate force to push and propel yourself through to your next step. So addressing running biomechanics can also be an important factor, and also a causative factor if your cadence is low as well. Let's talk about the signs and symptoms when dealing with an Achilles tendinopathy. Hallmark sign is always going to be your morning stiffness and morning pain. You get out of bed, you can't put your heel on the ground, things are stiff and painful, and it almost takes 5 to 20 minutes sometimes for that Achilles to get going and for your pain to settle down. You can get a similar sensation after prolonged sitting as well. From here, let's move on to the actual location of pain and when you palpate and press around your Achilles. Achilles tendon issues tend to be quite point specific on certain parts of the Achilles tendon, so it's quite rare that you'll get pain along the entire tendon. It's either going to be painful at the bottom, which is the insertional point of the tendon, or in the middle, which is the mid portion of the tendon. And it's important to remember this, and we'll talk a lot more about this when we're dealing with treatment in the early phases of your tendinopathy. From here, a single leg calf raise assessment is always good. How many calf raises can you do on one side before pain and fatigue comes on versus the good side where fatigue will come on? Compare the numbers as a baseline, and that will give you an indication as to what you're working towards in the long term to match and get your strength symmetrical. And finally, can you do a single leg hop test for 30 seconds? What does the quality of that hop look like? Are you hopping nice and fluently like your good side? Are you hitting the ground quite hard? And more importantly, is that bringing on symptoms in your Achilles? As always, seek some professional help, whether that's a sports medicine consultant, a physiotherapist, or a health professional in your home country to understand the severity of your Achilles tendinopathy, what your progressions need to look like, and then moving forward to getting your treatment for your Achilles as well.